Welcome to VetCare. Today, we are going to discuss Newcastle disease, ND, one of the most significant and economically important viral diseases in poultry production worldwide. Newcastle disease is caused by the virulent Newcastle disease virus, also known as avian paramyxovirus type 1. It is a severe, systemic, and often fatal viral disease affecting many species of birds, particularly chickens. There is no specific treatment available, and in many cases infected or exposed flocks must be culled to prevent further spread. Now let us understand how birds become infected. The virus spreads very easily through respiratory droplets when infected birds cough or sneeze. It is also transmitted through feces, contaminated feed and water, equipment, vehicles, clothing, and even farm workers moving between flocks. The incubation period typically ranges from 4 to 6 days but can vary from 2 to 15 days depending on the strain and host factors. Chickens are the most susceptible species, while waterfowl tend to be more resistant. Wild birds, including pigeons, migratory birds, can act as carriers and introduce the virus into poultry farms. Next, let us discuss the different types of Newcastle disease virus based on virulence. The velogenic strain is highly virulent and the most severe form. It can cause sudden death along with pronounced respiratory and neurological signs. The mesogenic strain is moderately virulent and primarily produces respiratory disease, sometimes accompanied by neurological symptoms, with lower mortality compared to velogenic strains. The lentogenic strain is of low virulence and typically causes mild or subclinical infections. These strains are commonly used in live vaccines. From a regulatory standpoint, only velogenic and mesogenic strains are classified as virulent and are considered reportable diseases in many countries. Moving on to clinical signs, Newcastle disease can affect multiple body systems. Respiratory signs include sneezing, coughing, nasal discharge, and characteristic whistling or gasping sounds due to breathing difficulty. Digestive involvement may lead to greenish watery diarrhea. Neurological signs are particularly alarming and may include tremors, torticollis, twisting of the neck, paralysis, and circling movements. In laying birds, egg production drops significantly, and eggs may appear misshapen, thin-shelled, or soft-shelled. On post-mortem examination, several lesions may be observed. These include petechial hemorrhages in the intestinal mucosa, edema of the head, and hemorrhages in the trachea and lungs. The spleen and thymus may also show signs of damage. However, these lesions are not specific enough to confirm the disease, which is why laboratory diagnosis is essential. Diagnosis of Newcastle disease cannot rely solely on clinical signs or post-mortem findings. Laboratory confirmation is mandatory. Common diagnostic methods include virus isolation from swabs or tissues, real-time RT-PCR to detect viral RNA, and serological tests to identify antibodies against the virus. Accurate diagnosis is crucial not only for treatment decisions but also for regulatory reporting and outbreak control. Finally, let us focus on prevention, which remains the cornerstone of Newcastle disease control. Strict biosecurity measures are essential to prevent the virus from entering poultry farms. This includes disinfecting equipment and vehicles, restricting visitor access, using dedicated clothing and footwear, controlling rodents and pests, and maintaining proper litter management. Preventing introduction of the virus is far more effective than attempting to control an outbreak. Vaccination plays a vital supportive role in prevention. It is important to understand that vaccines do not completely prevent infection, but they significantly reduce disease severity and limit virus shedding, thereby decreasing transmission. Live vaccines, such as B1 and Lesotho strains, are commonly administered through drinking water, spray, or eye and nose drops. They are easy to apply and stimulate good immune responses. Inactivated vaccines, which contain killed virus mixed with oil adjuvant, are given by injection and are frequently used in layers and breeder flocks to provide strong and longer-lasting immunity. Vectored vaccines use harmless carrier viruses, such as fowlpox or herpes virus, to deliver Newcastle disease antigens and can even be administered in ovo, meaning directly into the egg before hatching. Thanks for watching VetCare. If you found this helpful, don't forget to like, share, and subscribe for more simple and clear veterinary lessons.